Clinical and anatomical terminology is mainly based on a Greek or Latin root words. Let's take, for example, the term ampulla. Ampulla is a roughly spherical flask with two handles used in ancient Rome. In anatomical terminology, the ampulla is present in the inner ear as the swollen enlargement at one end of each semicircular canal. It contains the sensory receptors for dynamic equilibrium. In the pancreas, the pancreatic duct joins the common bile duct from the liver and gallbladder to form a dilated duct, the hepatopancreatic ampulla or ampulla of Vater, before it opens in the duodenum. In the rectum, the largest caliber is its lower third and forms the rectal ampulla above the anal canal. In the male, the dilated terminal portion of the ductus deferens or vas deferens is known as the ampulla. In the female, the ampulla of the uterine tube is the widest and longest portion in which fertilization takes place. Do you know of any other ampulla in the body?